Welcome back from the break. I'm Uday Pratap Singh. You're joining us on NewsX. The UK is witnessing a massive surge of COVID with over 90,000 daily cases being reported on a daily basis. 4 lakh cases have been reported in the last 7 days. The chair of the National COVID Task Force Dr. Vivek Paul, in fact, has warned that India could see an outbreak like the UK. India then could witness possibly 14 lakh cases per day. With the surge in UK, the administration there is racing to deploy booster doses. The question, though, remains, with the government's warning, is India prepared for another possible COVID wave? Have we learnt our lessons from the last wave? Is it time to prepare a contingency plan and are boosters a possible preventive solution?
That situation in many parts of the world, in particular parts of Africa, but also in particular in Europe, has gone worse compared to when we met last. ये डेल्टा से हो रहा है, पार्टली ओमिक्रॉन से हो रहा है, ऐसा ही दिखाई दे रहा है, बट द फैक्ट रिमेन्स कि यूरोप के देश एक बहुत ही सीरियस परिस्थिति से गुजर रहे हैं। ये इसके बावजूद भी हो रहा है कि वहाँ पे 76-80% एटलीस्ट पार्शियल वैक्सीनेशन का कवरेज हो चुका है, और ये इसके बावजूद भी हो चुका है कि वहाँ पे काफ़ी हद तक डेल्टा की वेव हो गई थी, हो रही थी। ये एक नया सिनेरियो एपिडेमियोलॉजिकली हमारे सामने इमर्ज हुआ है। ओमिक्रॉन का इसमें योगदान जरूर है, लेकिन वो 2.4% है, कितना है, ये जैसे जैसे आगे बढ़ेंगे इमर्ज होगा। मैं कुछ इसको फिगर से समझाना चाहूँगा। अगर जो केसेस कल यूके में हुए हैं 88,000 के करीब, 80,000 ले लीजिए, अगर हम उसको पॉपुलेशन के बेस पे लें तो ये 14 लाख केस होंगे भारत की पॉपुलेशन पे अगर हम उसको लगाएं। कहने का मतलब ये है, हमने वो 4 लाख वाली एक सर्च देखी थी, तो जो भी हो रहा है हम इसमें भी पूरी तरह से कहना कि डेल्टा है, दोबारा वाला डेल्टा है, ओमिक्रॉन की, ये इमर्ज हो रहा है। लेकिन द फैक्ट इज एट दिस वेरी टाइम द सर्ज बीइंग एक्सपीरियंस इन यूके इज टू द ट्यून ऑफ 14-15 लाख पर डे। माइल्ड है कहा जा रहा है, वो भी देख रहे हैं। हॉस्पिटल का भी इतना हेल्थ सिस्टम पे प्रेशर नहीं है, वो भी हम देख रहे हैं। लेकिन ये सब कुछ एक इमर्जिंग सिनेरियो है, कहाँ जाएगा कहना मुश्किल है, अनएक्सपेक्टेड सिनेरियो है।
Joining us live at this point is Dr. D.K. Gupta, CMD Felix Hospital. We also have Dr. Raju Vyas, Director Cardiothoracic Department, Fortis Hospital. Dr. Vivek Gupta, HOD Cardiologist, Apollo Hospital, also joins us live. Dr. Shruti Malik, Director Redix Hospital, is also on the broadcast with us. Dr. Shruti Malik, let me begin with you first. How do you view this warning which has been sent out by Dr. Vivek Paul on a day when the UK has registered its highest ever daily cases since the pandemic began?
Thank you so much for having me here. See, I would definitely say it is not dangerous, but it is alarming. The reason being, we should not falter in forecasting the way we did in our second waves. Seeing the population, the way Dr. Paul has said, see, UK has a population of 8 crore people, and when they are seeing cases around 80,000 per day, you can imagine in a developing country like India, how would that come up if we do not take precautions and take proper ways to downsurge it? See, because India is a country where we haven't yet vaccinated our children. Italy, few more European countries have already vaccinated children between the age of 12 to 18 years, and they have started the vaccination for kids between the age of 5 to 11 years. So that is one reason which is really alarming, I feel. But this transmissibility of this virus is obviously more than the previous strain, but definitely the symptoms, the hospitalization rate, according to the studies that have come up, is obviously less, but then we need to take severe precautions because we cannot falter this time.
Absolutely. So you do believe then, Dr. Shruti, that the time is now to put in place measures so that we don't reach that situation in 2 months' time? The time to act is now rather than tomorrow.
Definitely. See, the most important thing is we have a callous attitude here. See, everyone, because this New Year's is coming, Christmas is there, people are wandering around. They are doing non-essential travels, mass gatherings, super spreading events, and that could lead to an upsurge in the number of cases. And see, people here feel that we have got vaccinated, so we are safe. But vaccination is just one way to, safeguard yourself. The better way and the better, more ways to take action is to basically take precautions, and more than precautions, I feel we should work more on our comorbidities, on our obesity, on our other issues which are going to be alarming if there is a lot number of cases seen in coming few days.
Okay, let me also in fact try and get in our other guests at this point as well. Dr. Vivek Gupta, let me draw you in here at this point. Dr. Vivek Gupta, do you believe this is a time for a COVID red alert in the country? This is a time for an Omicron red alert in the country? Do you believe that Dr. VK Paul's warning should be taken seriously, or are we over-imagining?
No. I don't think we are over-imagining. We have already we have already really been a big problem during the wave 2, and once bitten, twice shy. And in fact, we have been bitten twice. We have to be twice bitten, thrice shy. So what I will see that if Omicron is 3 times more infective than Delta, and if the number of cases are going up like spirally in France and UK, and the elections are on here, and the things are going so pretty well everywhere without major masking and sanitization or the social distancing. And let me tell you that social distancing and sanitization is a little more of farce, but I would say that mask is very important. So if he says that 15 lakhs cases per day may be seen if the third wave comes in, then of course 15 lakhs means 15 lakhs, because when we see 4 lakhs per day cases during the COVID wave 2, we were always saying that we are not testing that much and maybe we are missing some data. So I believe that during COVID wave 2, we were having at least 8 lakhs cases per day during the peak of the COVID wave 2. So what we have to do? We have to be really very cautious this time. Although we are finding reports from South Africa as well as from USA that this virus may not be that virulent as Delta, but we are not too sure about that. Of course, we are now more vaccinated at this point of time. We have a herd immunity. We have a long-term immunity. Those who have 70% of Indian population already infected. And antibodies are not the real marker for their protection. It is B-cell and T-cell immunity, long-term immunity, cellular immunity, which cannot be measured by any criteria as of now, lab criteria. So we are more protected than wave 2. But considering that if so many patients get infected during wave 3, if at all it happens, then of course we have to be a little more careful, because still there were few percentage of patients will require hospitalization. And those who are, if we say 70% infected, 30% still not infected. If 30% population gets infected by this Omicron, I would say that we have to be very, very careful. With a large population of under 40 crore population, 30% population not protected means at least 30 crore or more, 40 crore population not infected, not protected, neither by vaccine nor by innate immunity, which means that they have been infected earlier. So 40 crore population is a huge population. It is 5 times more than British and 5 times more than France, which is only 8 crore population. So this population is not protected. Therefore, we have to be very, very careful. We have to stop doing conferences for the time being, only 2 months. We may stop the flights. We may have a rigorous criteria for masking. We may have in the form of red alert, what you say. That means at least we should have a challan and all those things. We have to be something like what we did in April after the COVID wave 2 came in. So we should not do like this as we did last time. We have to be very, very careful, because 40 crore population not protected neither by innate immunity, which is when you get infected, nor by vaccination. And there is a huge population of our country. We have to be very, very careful. Don't take it under, and red alert is important. Dr. VK Paul, I know personally, is a very fine man. He does not state anything without the data. And if he has said something, we have to take it seriously. India, we cannot afford to have another third wave like wave 2, where more than so many lives were lost and 4,000 deaths were happening, which was actually data which was always debatable whether it was actually 4,000 or even more. A lot of dead bodies we saw in Ganga and Yamuna. So we don't want to have that. We have to be really protection. So what is the way out? The way out will be vaccination. You cannot increase immediately, but booster dose, I would still say, because I got, for example, I gave my example. I got the second dose of Covishield in February. Now I am 10 months away, almost 10 months. I have not checked my antibody level, but I feel that I should get a booster dose. So booster, when you have a lying extra dosage of million doses, the SSI says, Serum Institute of India, SII says that they can build more Covishield. So what is the, I don't know what is the hitch in the mind of the government not to be able to decide for the booster dosage, which is going to be really helpful for those patients who have not got COVID earlier. So I would say the government should take immediate attention to giving the booster dose, allowing the booster dose, especially those who have crossed 6 months of the second dosage, and especially the healthcare workers and the patients who are diabetic or hypertension or heart diseases around 60 years of age. Similar criteria what we had the first, you see the first vaccination started in 16 January 2021. And that was a time when we had a strict criteria that only those particular patients, only healthcare workers, then came more than 60 years, then came less than 60 years, then came less than 45 years. We are still not done vaccination for the 12 to 18 years, but they are more protected, I would say. I would say the children are still not that vulnerable. The reason is, whatever virus, they have a large, better immunity than the patient of 50-year-old who is hypertensive or diabetic, or any healthcare worker who's in the age of 50 to 60 years. So I am not concerned about the children getting vaccination. I'm more concerned about the booster dosage for those vulnerable population which have already crossed the 6 months and there is no way. You can only test the antibodies. I don't want that antibodies should be tested. It's impossible to test the antibodies of such a large population and then go ahead for the booster. 6 months crossed, go for the booster. That is going to protect from third wave. I personally feel that third wave, if at all, you see, here is one Niti Aayog, and this is one doctor who's talking, because I follow the patients very regularly of my COVID. I still say, when I did a Facebook Live, I said third wave is possibly not coming. The reason why I say, because when I say 70% population is already infected, but when I check the herd immunity, serosurveillance, which has been done in Delhi, is about 96% or 90% in Delhi, otherwise 80%, 70 to 80% criteria. Third wave means what? More than 1.5 lakhs per day, if you start having per day, then of course third wave. Let me tell you one more thing. We have to increase our testing. You see, England is testing about 18 cases per 1,000. We are testing as of now only it is less than 1 per 1,000. During the peak time of COVID wave 2, we tested 3 patients per 1,000, 3% per 1,000. So we cannot reduce the number of testing, because that is the only way you will come to know the exact number of people who are getting infected, because the numbers are very important. As of now, we are very happy that only 7,000 to 8,000 patients per day is coming as far as COVID is concerned. That's a very good news. But when I was comparing, because I just came to know that what England is testing is 18% person per 1,000. What we are testing is around 1 per 1,000. As of now, we have to increase our testing. We have now, under the Prime Ministership of Mr. Narendra Modi ji and the Health Minister, we have a large people who can be tested. We are not short of the RT-PCR kits as of now. Earlier we were. We are not short of RT-PCR kits. We have a huge number of people who can actually be a huge number of people who can really utilize our manpower to test the people.
Dr. D.K. Gupta, do you believe also, like Dr. V.K. Paul has said, that there could be that many lakh cases, 14 lakh cases every day after this Omicron surge? Can we prevent that, or are we headed in that direction already, Dr. D.K. Gupta? Because we are all seeing how the UK is breaking record day after day, and that is being attributed to the Omicron surge.
I think we are having the same problem or same scenario that we have last year during the Delta wave also. In January last year, there were a few cases in India, and till March, April, there were huge number of cases increased, and there was a second wave, and we were not able to manage that wave also. And there was a demise of several people in each and every family in that second wave. And same thing was happening in the UK at that time, just before our Indian scenario, but nobody took it seriously. Nobody took it seriously. So I think this is a high time we should know that the virus has high infectivity. It is 4 to 5 times more infectious. It is having replication rate more than 70 times, and got to know from the Hong Kong study that it replicates more than 70 times, but the replication is limited mainly to the upper and middle lung, that is till up to the bronchus only. It is not going to the lower side of the lungs, that is in the alveoli. It means it will less cause pneumonia and ARDS. But we have a huge population of 1.35 billion, that is around 135 crore, and if it comes in India and with the similar rate, if we have 10 to 15 lakhs cases per day, what will be, if there is a 0.1% mortality rate also, then it will be significant. And hospitalization rate, it's less also, then it will be significant. We will not be able to provide beds also. So I think this is a huge high time we should think about the booster dose, that because we know the efficacy of the vaccine is less against this Omicron. WHO has already told day before yesterday the current vaccines are not efficacious, or they are less efficacious against this Omicron. But still there is efficacy. The government should consider about the booster dose as early as possible, specifically for the frontline workers and the comorbid patient, because we cannot develop new vaccine in 1 month or 15 days and we can inoculate the whole population within 1, 2 months or 3 months. It is not possible right now. Therefore, whatever vaccine we have right now with lesser efficacy also, the booster dose should be immediately allowed to the frontline workers, including doctors, paramedical nurses, and to the comorbid patient who are having diabetes, hypertension, asthma, kidney transplant or dialysis patient, cancer patient. They should be given. Third point, children are more than 40 crore in India, and I will not agree with the speakers that they are not at high risk. I'm a pediatrician. I know that there are most of children, they suffered from the post-COVID multi-system inflammatory syndrome also. And we know that the data collection is not very good in India. There are so many children in rural area also, they were having a similar illness after 6 to 8 weeks of recovery from the COVID. So that was not captured in any census. That's why it was not. It means they are at high risk, they are vulnerable, they are unimmunized. At least primary immunization should be given to them. And why don't know why government is not acting on that. Already the vaccine has been approved by CDSCO, SCPC, DGCI. There are 2 vaccines available right now, Zydus COVID, and the second one is Covaxin. Also, the Covishield is in pipeline. But 2 vaccines are available. They are having doses also. There is some negotiation, I don't know, going on regarding pricing or something like that. But it should be rolled out as early as possible. We don't want to compromise on children because now they are exposed in high risk. And I would like to tell also COVID appropriate behavior. The social vaccine is most important vaccine that can prevent from any droplet infection, including COVID. Any strain can come, but we can prevent from the COVID-appropriate behavior. And now all people in India, they are not following COVID-appropriate behavior. Even government is not taking any strict actions. Now it's again high time that we should implement these COVID-appropriate behavior at ground level, at any place, and all the public should be aware. They should be educated. They should be trained regarding masking, regarding hand hygiene, regarding respiratory hygiene, because now this is need of the hour. Because if we cannot prepare ourselves in 2 months, we cannot put so many extra beds in 2 months, we cannot put ICU beds, we cannot train doctors or nursing staff within 2 months to tackle 15 to 16 lakhs cases per day. This is not possible. And I am telling you, in India also, or globally also, what we are seeing, it is tip of iceberg. With every positive case, there will be hundreds of positive cases. They will not be detected because they will be asymptomatic, or they will not be diagnosed. There will not be investigation done on these patients. It means we need to be very proactive, very futuristic regarding the number of cases can happen in next 2 months, and what can be prevention, and how much we can delay that surge that can happen in month of January or February, that can be delayed. For that, a strict measure has to be taken from the state government, also from the central government. And I think the political rallies, whatever happening in, like there is coming in day, there will be elections in the different states also, and there will be different type of religions and gatherings are there. So all the public gathering, that can be political rally, religious rally, or personal rally, marriages, everything should be banned for at least 2 to 3 months. We should wait and watch. If everything is okay, then we should again open all these things. But otherwise, those things, whatever is not necessary for current economy, they should not be opened. Like political rallies, and even most of things can be done right now online. It is not advisable to go for physical rallies nowadays. So I think political...
Okay, so you're raising the red flag on the upcoming election rallies as well, because we saw what happened after the Bengal elections.
Yes, I totally agree with you. Even in Panchayat Chunav, we have seen that there are so many teachers and so many election workers who went into the Panchayat Chunav and they were died after the Panchayat Chunav. They were having, have got infections from COVID after the elections. Yeah.
Dr. Raju Vyas, come in here. Dr. Raju Vyas, what should be the priority right now for the country? Should we immediately impose further restrictions vis-a-vis quarantine measures of people coming in from abroad, because the frequency of those testing positive from abroad is increasing day after day? Should we, come up with containment zones, more mini containment zones? Should certain restrictions also be imposed? What should be the priority currently of our country in dealing with this surge? Should we also look at now booster doses with more increased sincerity than what we were doing earlier, looking at the Omicron surge?
So the priority of the country should remain the people who are coming from abroad. They should be tested, as government is already testing on the airports. Their testing ability should be increased. There should be restriction on international flights coming to India. Number two. Number three, what I would like to say is that the number of testing which is happening in our country itself is very low. At the moment, we are just testing 50,000 cases per day in India, a country like India, which is very small, minuscule amount of testing. It should further go up, number three. Number four, as you rightly said, there are many patients which have now come up as a positive COVID patients. And majority of them still are Delta variant. Remember one thing, Omicron is one very small amount, 2 to 3% of the total samples which have been taken. So that means in India, Delta variant is still predominant. Omicron is very small number of cases. They are asymptomatic, very mild symptomatic, but we should not forget to keep restriction all around the country, in the states, even in the border areas, from one state to another state. If somebody is crossing, we have to recheck about their vaccination drive as well as their RT-PCR test. So these strict measures should be taken. Not only that, my fellow panelist has already told about doing, you can say, a third dose of vaccination for all our frontline workers, which is necessary, and government should rethink about starting the third dose of booster dosing for the healthcare workers immediately.
Okay, that's something that they should prioritize, at least for the frontline workers who will once again be dealing with this latest surge in COVID cases in the country. All right, let's leave it at that. We'll be continuing these conversations as we, of course, track this Omicron increase in COVID cases in the country. It's not yet, of course, alarming, but yes, Dr. VK Paul's warning is ominous. We must act now. We must not wait till tomorrow. Let's leave it at that. My thanks to our guests once again for joining us.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.